Hello, I'm Dr. Moumita Bagchi. I'm a consultant neurologist practicing in Calcutta, attached to AMRI hospitals and ILS hospitals in London, Calcutta. I'd like to talk about epilepsy. Now, epilepsy simply means that there are a number of seizures which occur frequently. Seizure is something which means that there is an excessive electrical activity in the brain. Now, why seizures occur? They can occur because of some diseases in the brain, like some sort of dyselectrolytemia, a blood sugar fall, and they can occur because of some liver disease, kidney disease. They can occur because of some medication overuse, alcohol excess, alcohol withdrawal, drug excess, drug withdrawal, medications, etc. And there are lots of other causes. There is some genetic preponderance for seizures also, and we have some genetic diseases which causes lots of seizures. And when these seizures, and one single seizure will not cause epilepsy, but when the seizures occur very frequently, then we call them epilepsy. Now, whether epilepsy can be cured or not depends upon the type of epilepsy it is. Some epilepsies, like those which occur in the childhood, do not recur in adult life. But sometimes these epilepsies continue throughout life. This is one of the best examples of this kind of disorder is juvenile myoclonus epilepsy, which occurs throughout the life and for which medications have to be taken throughout the life. Now, how do we recognize that the patient has seizure? Now, usually the seizures can be broadly classified into two groups. One, partial seizures. Second, generalized seizures. And we have some seizures which start as partial seizures and then go on to generalized seizures. Now, what do we mean by these terms? Partial seizures means that the seizure activity is localized to a part of the brain, whereas generalized seizure means the seizure activity spreads throughout the brain. When the patient has partial seizure, the patient might start with just a staring look, have a fear of something. Then the patient might start smelling something, like have a staring look. This is important to recognize that this is a partial seizure. And sometimes these partial seizures go on to generalized seizure. Then the patient can have a staring look which is prolonged, and then fall down. They can wander aimlessly, have a generalized tonic-clonic, that is a generalized convulsive movement, and they pass urine and stool. They can have drooling of saliva at that time, and they fall down. And at the end of the seizure activity, usually the patient regains consciousness after some time, and then the patient at the post-ictally, that is after the seizure passes off, the patient may be very tired and may be exhausted, goes off to sleep for some time. So this is normally how the seizure occurs. But if the seizures are prolonged, and if the seizures and the patient does not regain consciousness after the end of the seizure, then it is important to call a doctor and go to a medical facility at that time. Now, how do we treat seizures? The treatment of seizures, we have a number of anti-epileptic drugs which are quite effective in seizures. However, about 20% of cases are refractory to all medications. Sometimes, in these cases, surgical treatment helps. Surgical treatment might decrease the number of medications and might also actually, in some cases, might go on to have a complete reprieve of the seizures. Now, what are the do's and don'ts when you have an epilepsy? The do's are, you have to take your medicines properly. You do not forget your medicines. You have to take your medicines at the scheduled time and every day as required. Second, do not panic. Epilepsy is not something. There are lots of people, famous people who have epilepsy, so do not panic if you have a diagnosis of epilepsy. And you can do most of the activities along with epilepsy with some precautions, like you should have proper sleep. You should not swim without supervision. It is in fact preferable that you do not swim at all. And if you swim, there should be someone over there who can help you if you are in trouble and who knows that you have a condition like this. And don't drive if you are having active seizures, and if your seizure is not controlled. Do not get on a cycle without protective gear. Do not use a bike in any form. Do not sit in very close to the TV and video because it can flash off a seizure. Flashes can trigger off a seizure. It is important if you have a seizure activity that that the person nearby does not panic. It is important to prevent falls. Just prevent a fall. It is important to support the head, and do not insert anything inside the mouth during a seizure activity. If the seizures are prolonged, then you have to consult a medical doctor or go to a medical facility. Otherwise, most seizures are self-sufficient and will stop after some time. There are some myths associated with epilepsy. Epilepsy is not a contagious disease. So, unless and until you have a contagious disease like some infectious disease. And epilepsy it will not be cured if you put some leather instruments or something like that near the mouth. Do not put any spoon or anything during the mouth during an epileptic attack. It will cause trauma. And it is important if the patient is a child, that the teacher is informed about the child's potential epileptic attack, so that the teacher can help the child during an epileptic attack. And epilepsy should not be hidden away. It is not a disease which cannot be treated. Most epileptics are well controlled on medication. So it is preferable that you start the treatment early in case of an epileptic attack. And it is important to continue the medicines if required. Women with epilepsy should take some precautions. Some oral contraceptive pills, actually the efficacy of oral contraceptive pills will change well on medications. And those who are planning for a pregnancy, they might need to go for a safer medication. But there are some safe medications which will not cause any harm to the baby while the mother is pregnant. And so there are lots of medications which are available. So even in the women, it is not a taboo to have epilepsy. There are some seizures which unfortunately increase during the menstrual activity. Now, most such seizures can actually be controlled with normal anti-epileptic drugs, but you might sometimes require some special anti-epileptic drugs to control these kind of seizures. Children with epilepsy can do all normal activities, except that the child should not go near the swimming pool without supervision, and the child should not be near a fire. The child should take some precaution while crossing the road, and otherwise the patient can have all normal activities. And normally some childhood seizures do stop after some time, and so some childhood seizures actually have a better prognosis than those which occur in the adult life.